What is post-void residual, PVR urine volume in BPH? Imagine trying to empty your bladder completely but feeling like there's still some urine left behind. That leftover amount is what doctors call post-void residual urine volume. It's the amount of urine remaining in the bladder immediately after you urinate. This measurement is really important because it shows how well your bladder is emptying during urination. In benign prostatic hyperplasia, or BPH, the prostate gland enlarges as men age. This growth usually happens around the part of the prostate called the transition zone, which surrounds the urethra, the tube that carries urine out of the body. When the prostate enlarges, it can squeeze or block the urethra, making it harder for urine to flow freely. This blockage can cause the bladder to not fully empty, leaving more urine behind after urination. To measure PVR, healthcare providers often use a simple ultrasound scan of the bladder or may insert a thin tube called a catheter right after you urinate. The goal is to see how much urine is still in the bladder. Normally, a PVR of less than 100 milliliters is considered healthy. Sometimes, up to 200 milliliters might be acceptable, especially in older men. But if the residual urine exceeds 200 milliliters, it suggests that the bladder isn't emptying properly. When volumes go over 300 milliliters, it can be a sign of significant urinary retention, which might need urgent medical attention. In BPH, the enlarged prostate causes narrowing or blockage of the urethra, leading to symptoms like a weak or interrupted urine stream, difficulty starting urination, a feeling of urgency, frequent trips to the bathroom, especially at night, and the sensation that the bladder isn't fully empty. The increased residual urine volume is a direct result of this obstruction. Over time, this can cause the bladder muscles to weaken or become overworked, leading to further problems such as urinary tract infections or even acute urinary retention, where you suddenly cannot urinate at all. Measuring PVR helps doctors understand how severe the bladder outlet obstruction is. If the residual volume is high, it might mean that medical treatments to shrink the prostate or improve bladder function are needed. Sometimes, if the obstruction is very severe, surgical options might be considered. Monitoring PVR over time also helps assess whether treatments are working or if adjustments are necessary. In summary, post-void residual urine volume in BPH is the amount of urine left in the bladder after urination, caused by prostate enlargement blocking urine flow. It's a vital tool for doctors to evaluate how well the bladder is functioning and to guide treatment choices. Always remember, if you experience symptoms like difficulty urinating or feeling your bladder isn't emptying, it's important to consult a healthcare professional for proper assessment and personalized advice.